If you are a combat lifesaver, you have access to the Universal Malleable Splint, also referred to as the SAM splint. This program will demonstrate the proper application of the splint to various fracture sites. Your first action upon encountering a casualty is to evaluate the casualty and administer any necessary life-saving measures. Before applying the splint, loosen the casualty's clothing around the fractured limb. In the case of a fractured upper extremity, remove any jewelry the casualty is wearing. Explain to the casualty that you are doing this because of the possibility of swelling in the area later. Place the jewelry in the casualty's pocket. To prepare the universal splint, first unroll and flatten it. Then fold it in half so it is a tall V shape. The way the splint is folded and applied will vary according to the length of the limb. We will discuss the proper way to apply the splint to the lower arm, upper arm, lower leg, and upper leg. Bend the edges of the splint in until the shape of the splint conforms to the curve of the limb to be splinted. Bending the edges in also increases the rigidity of the splint. Apply the SAM splint to the fractured limb so the fracture is between the two sides of the splint. Adjust the shape of the splint to fit the limb. In some cases, such as a fracture of the thigh, 2 SAM splints are needed to effectively immobilize the joints above and below the fracture site. For a fracture of the upper arm, fold the splint into an uneven V shape so that one side of the V is about 4 to 6 inches shorter than the other side. Apply the splint to the fractured limb so that the short side of the splint is in the casualty's armpit and the long side extends to the shoulder. Make sure that the short side of the splint does not press into the casualty's armpit. Secure the splint using at least 2 cravats. Apply cravats above and below the fracture site. Do not apply a cravat directly over the fracture site. Tie the tails of the cravats in a non-slip knot on the outside of the splint and tuck in the tails. The location of the fracture will determine how the splint is positioned as well as the number and placement of cravats. Check the casualty's pulse below the most distal cravat. If you cannot detect a distal pulse, loosen the cravats, reapply them, and check the pulse again. If the SAM splint was applied to a fracture of the upper arm, lower arm, or wrist, apply a sling and swath to further immobilize the fracture. Caution the casualty to remain still until further medical treatment is obtained.
Okay.